Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA presents this week's breaking news in wellness and health for all people and all professionals. Welcome. We're glad to have you with us. I'm the Pete of Dr. Z and Pete. This is my good friend, my associate, my co-host, Dr. Alex Raymond Zechariah. He is the CEO of CNN4All International as well. I am the CEO of Bethel House of Refuge in Muhammad, Illinois. Previous to that, I was president of a commercial construction company in this central Illinois area. I, with my wife Stephanie, reside in Farmer City, Illinois. Stephanie is a travel specialist with the University of Illinois in the Electrical Computer Engineering Department. This is my distinguished host, co-host, Dr. Alex Raymond Zechariah, MD. Doc is also a medical professor, and as I mentioned, the CEO of CNN4All International. Welcome, Doc. Recently, Doc was the Chief Medical Officer, the Medical Director of Provena, now President's United Medical Center in Danville, Illinois. He was there in that position in all of 2008 and part of 2009. Prior to that, he was dean of one of the top 12 medical schools in Ludhiana, India. Out of 300 medical schools, this is among the top 12. Christian Medical College in Ludhiana, India. Doc and his wife Prema, also a retired physician, a lot of doctors in the house, and a professor, spent 43 years at Christian Medical College in Ludhiana, first as medical students and as faculty until they retired in the year 2000. They now reside in Urbana, Illinois, where they've been since 2005. Doc, you got a great resume. I need for you to tell the people what we're doing here at Breaking News.
This is for your information only. Do not change your treatment based on this info. You can ask your doctor to see this program.
You bet. Come on, watch it. If you would like to communicate with us, you can do that. Email.
Yes.
CNN, the number 4, all.com.
Yes.
Okay? We are going to be, addressing a number of health issues and problems that people have. So we'd like for you to ask your physician to watch.
Yes.
If they'd like it, if you're talking to a physician. Remember, you can communicate. Breaking news at CNN, the number 4all.com. Okay, yes. Doc, we're checking about mental disorders in midlife. Oops. Older adult, more prevalent than previously reported. Common methods of assessing physical disorders may consistently underestimate the prevalence of mental disorders among middle-aged people, Doc, and or older adults.
A new study from Johns Hopkins, Bloomberg School of Public Health was published January 8th online before it's printed. The edition of JAMA Psychiatry. The takeaway is that lifetime estimate based on participant recall in cross-sectional surveys underestimate the occurrence of mental disorders over the lifetime.
Underestimate, not good, is it? Nociceptin, nature's balm for the stress. That could be me, Doc. The findings confirm the importance of this stress-damping system known as nociceptin system as a potential target for therapies against anxiety, disorders, and other stress-related conditions.
This was published in January 2014 issue of the Journal of Neuroscience, 2014. Yes, nociceptin, which is produced in the brain, belongs to the family of opioid neurotransmitters, and that nociceptin can act in the amygdala, that's in the center of the brain, a part of the brain that controls basic emotion responses to counter the usual anxiety-producing effects of acute stress. This is just a finding. Down the road, we may have clinical use.
Okay. Well, we have some other news, too. The young children engage in physical activity in short spurts. They're preschoolers take 11 hours to attain daily exercise levels. If you've got a preschooler, you say, are you kidding? Well, they require a majority of their waking day, approximately 11 hours, to achieve their recommended daily physical activity. This guy's never been in a daycare center.
The study from Vanderbilt, a study published in the journal Obesity, December 2013. Children in the study ages 3 to 5 achieved this activity through relatively short bursts of energy expenditure, as opposed to the longer and more routine periods of exercise typically exhibited by adults.
Yeah, I look at him and say, would to God that I had that energy.
Yes.
Integrating frequent short bursts of moderate to vigorous physical activity into places where preschoolers spend their waking hours, whether it be in daycare or at home, should be considered. I just got to say, I'm from Missouri. You got to show me this.
Yeah.
Okay. Well, we're moving from kids moving around to heart attacks, and it says that heart attacks hit the poor people the hardest. As people get older and their bodies wear down and they become less resilient, in old age it's common for people to become clinically frail, and this frailty syndrome is emerging in the field of public health as a powerful predictor, Doc, of healthcare use and death.
Frailty, yes. The study from Tel Aviv, Israel, University in Israel, published in the International Journal of Cardiology, January 2014, have found that poor people are more than twice as likely as the wealthy to become frail after a heart attack. This should help doctors and policymakers to improve the post-heart attack care for the poor. They found a strong connection between frailty and socioeconomic status.
Well, and it's got to have something to do with your ability to access it
right.
monetarily, economically. And, you know, they're preaching Obamacare is going to do it, but I got to tell you, again, Doc, I'm from Missouri. Wait and see. Show me. Okay, we've talking about all of these things. Several forms of vitamin E, protect against memory disorders. Elderly people with high serum vitamin E levels are less likely to suffer from memory disorder than their peers with lower levels.
Yeah, we have done vitamin E before. According to a study from Europe, from Finland and Karolinska Institute in Sweden, I was there.
Okay.
Just visiting. Published in the Journal of Experimental Gerontology, that's adult
people.
January 2014. Various forms of vitamin E seems to play a role in memory process. 8-year follow-up, it was discovered that higher total serum levels of vitamin E and higher levels of tocopherol, vitamin E derivative, and so on, in particular, seem to protect against memory disorders.
You know, I've heard about that for a long time, so I'm boosting my vitamin E because I seem to have some memory issues. All right. We must lower fat content for adolescents' diets. Really. The prevalence of excess weight and obesity among adolescents, and as a result, the concomitant problems has increased considerably in recent years. That's right, Doc.
Yes. A study from the University of Basque Country in North Spain was published in the Journal of Clinical Nutrition,
That was
January 2014.
That was good.
Yes, has confirmed that irrespective of the total calories consumed and the physical activity done, an excessive proportion of fat in the diet, McDonald's, in a greater accumulation of fat in the abdomen.
Oh my goodness.
So,
well, okay, now here we're coming back to this little thing. Health and wealth connected. We ring in the new year, Doc, with the hopes of being healthy, wealthy, and wise. That's me, that's you, that's us. And a new study suggests that health and wealth may have a strong connection, and it's maybe stronger than what anybody previously thought.
Study from San Diego State University, published in the American Journal of Preventive Medicine, January 2014, showed that poorer one is, more the health complaints.
All right, complaints. Now, my mom was never a rich person. She's 95, and she has been healthy as a horse.
Yep.
Didn't have problems like that, and me too. I don't have that many problems. Okay. I got a new granddaughter, breastfeeding associated with a lower risk of rheumatoid arthritis specifically. That's good news for us. It showed that women who had breastfed their children were around half as likely to have RA, rheumatoid arthritis, compared to the women who had never breastfed.
Yes.
Another reason to breastfeed.
In a new study of over 7,000 older Chinese women was published online January 7th in the journal Rheumatology. This is the first study to demonstrate a link between breastfeeding and lower risk of rheumatoid arthritis in a Chinese population where breastfeeding is a common practice and more prevalent than in many Western populations. Our people should do it.
Yes, our women, and because of how it affects them physically, they tend not to do that. 8 million lives saved. This is an estimate since the Surgeon General's tobacco warning 50 years ago. A Yale study estimates that 8 million lives have been saved in the U.S. as a result of anti-smoking measures that began 50 years ago this month.
Yes. With
the groundbreaking report from the U.S. Surgeon General outlining, are you listening, smokers, the deadly consequences of tobacco use. Wake up.
The Yale School of Public Health led analysis is published in the Journal of American Medical Association, January 2014. 8 million lives have been saved, as you said, computer calculation, result of increasingly stringent tobacco control measures that commence with reports January 11, 1964 release.
That was Lyndon Johnson.
Yes. Yes.
Okay, here's what they want to do. Government intrusion. Sugar-sweetened beverage tax could reduce obesity and type 2 diabetes in India. That's could is the operative word. A sugar-sweetened beverage tax could help mitigate the rise in obesity and type 2 diabetes in India among both urban and rural populations. What do you think, Doc?
Yeah, this study from Stanford University, USA, was published in PLOS Medicine, January 2014. It was estimated that 20% sugar-sweetened tax in India could, 11 millions could affect the obesity over it. 400 cases of type 2 diabetes between 2014 and 2023.
Oh, my goodness.
Yes.
Now, this is what they're talking about. You know, I personally, this is my personal opinion, I'm reluctant for government to legislate healthcare issues because what's the song? We should all treat ourselves, right?
Ourselves,
That's
not
right.
government.
So I don't need the government telling me that, and it doesn't work. You have to be convinced that this is for your well-being. And so smokers, pop drinkers, all that sugary business, you have to consider what the long-term effects are on your health. Let's begin to treat ourselves in 2014.
Yes.
We want to thank you for being with us. Thanks for being with us today. We have a guest, I think, right?
Yes.
Okay, so we're going to take a break, but we'll be back in a minute with our more distinguished physician, Dr. Ross Yoha.
Travel advisories to small business loans, student loans, to taxes online. Whether you have information to get or ideas to give, USA.gov is the official place to connect with your government. From surplus car auctions to finding a new job, our new mobile apps will keep you updated on the go. So check out USA.gov because the country runs better when we stay connected.
Compassion Now Network for All, in short CNN4All, Urbana, Illinois, USA,
and Bethel House of Refuge, Muhammad, Illinois, USA, presents this week's breaking news in wellness and health for all people and for all professionals. Hi, I'm the Pete of Dr. Z and Pete. This is my distinguished co-host, Dr. Alex Rama Zechariah. And Doc is also a medical professor and the CEO of CNN4All International. We have a more distinguished guest with us today, and he is an expert. He's joining us, Dr. Ross Yoha, MD, and welcome, Dr. Ross. We're pleased to have you with us in the new year.
You know, one correction, this year He is not distinguished.
Okay. You're distinguished, and Dr.
Last year.
Rema is
Yeah, this
more
year he is
distinguished.
my
All right.
friend.
So you're working on some humility, right?
Actually, you taught me.
All right, that's good. Well, today our panel discussion is going to revolve around diet and heart disease. So you recognize those connections there, right, Doc? So I need for you to tell the folks just exactly what is the connection between diet and heart disease? Is there a connection? Why don't you just let them know what you think?
Yeah, it is very well connected. A heart healthy diet help men at high risk for heart disease reduce their bad cholesterol regardless of whether they lost weight. See, that's an important finding. This study was presented last year, and the study was in the American Heart Association's 2013 scientific session.
Well, I got a question.
The risk factors included in the study were high waist circumference, that's correct, and high blood pressure, and high levels of triglyceride, the bad cholesterol.
Okay.
And the fasting glucose also high, and low levels of high density lipoprotein, or what is called good cholesterol.
That's HDL?
That's right.
All right, so what we're after, let's make it plain. I mean, you guys, doctors, a lot of times they talk with these $20 words, and the patient doesn't even understand high density lipoprotein. So what is basically the difference between the LDL and the HDL in common generic terms, Dr.
You know what? Any fatty fried food is low cholesterol.
Really?
Yeah, any.
LDL?
And Mediterranean diet with olive oil and that type of, have thoroughly unsaturated fat containing ones, they are good, they are better oil.
Would you say that the economic and marketing function would affect how we see things? I'll give you, for instance, Dr. Ross, the difference between margarine and butter.
You got it. Yes, that's right. Those are the type of things that we need to stay away from both if possible.
Yeah, both if possible. What if it isn't possible? What if you need one or the other? Which is preferable?
Margarine is not good. You know what margarine is?
Yeah, well, it's oil. It's got...
No, it is dissolved plastic.
Yeah, hydrogenated...
It is plastic.
Vegetable oil. Ugh.
So butter is...
More, that's what I'm thinking. Butter is better.
1,000 times better. A little bit of water doesn't hurt.
All right, so tell me, what does good cholesterol do as opposed to bad cholesterol? How does it work in the body?
That's a good question, because that cholesterol is the one that gets deposited in the arteries, and you know what? It gets narrow.
It narrows the arteries.
Yeah, and interestingly, good cholesterol eats up the bad cholesterol. They are scavengers.
Scavengers, so it's like the bottom feeders in the ocean. They get all
right.
Okay.
That's right. Get
all
the
right.
good cholesterol high.
Really?
Uh-huh.
Now, have they got any studies to substantiate that?
Yeah, that's right. They, the study they found that the men followed a standard North American diet,
Yes.
which is high in fat and carbohydrate.
And low in exercise.
Yeah, refined sugar, red meat.
Oh.
For a second 5 weeks, they ate Mediterranean-style diet, which is high in fruit, vegetables, whole grains, low in red meat. It also includes olive oil and moderate wine drinking.
Hey, all right. Now you rang the bell. Now listen, Doc. I had a New York strip steak the other night. It had mushrooms that were cooked in olive oil, romaine lettuce in the salad with an avocado, and sweet potatoes. What do you think?
That is excellent. You must eat the good stuff.
Yeah, buddy. That
keep
steak
it,
was good.
And also, the keep it not huge.
Yeah. Well, my steak was like under 32 ounces.
You know what the study found?
What?
Regardless whether the patient lost weight following the Mediterranean-style diet, the result found there was a 10% drop in bad cholesterol and a rise in good cholesterol.
So you have a drop in bad cholesterol, you have a rise in good cholesterol, and to boot, you got wine drinking in it.
Absolutely. Eat
great.
well.
Eat well.
Yes, eat more.
More?
Yeah.
Come
More
on.
of veggies, whole grain fruits. Go nuts on nuts.
Oh, really?
Eat less.
Less? Now less?
Yes, eat less. Less of starch food, sugar. And say no to soda thought.
Oh, say no to soda pop. All right, I'm on that.
Yeah.
Now, also we want to discuss about diet in middle age. If you're porky, couch potato, and have been that way up to middle age, is it too late to change?
No, any day, any time, any year is a good time to start.
Oh, yeah.
And you know what? This is according to a research presented at the American Heart Association Quality of Care and Outcome Research Scientific Session 2013. As more people survive heart attacks and live with heart disease,
Right.
the number with heart failure is increasing.
Uh-oh.
More than 5.1 million Americans live with heart failure. Improving fitness is a good heart failure prevention strategy. That's very important. Especially after heart failure, they should be fitter.
Yeah, an ounce of prevention's worth a pound of cure.
And it is never too late to start exercise.
And what's a good way to do that, Doc?
And exercise more.
More.
5 times a
5
week.
times a week.
Half hour or more till soaked in sweat. Exercise more. Walk, jog, run, bike. Treadmill, elliptical. Till soaked in sweat.
All right, we talked about middle age. What about adolescent porkies? Should they be in good health as well, or at least working on it?
You know what? Adolescent poor health behaviors raise risk of heart disease, diabetes as adults.
Really?
U.S. adolescents high levels of poor health behaviors, unfavorable cardiovascular risk factors may increase their chances of heart disease as adults. According to a new research published in the American Heart Association journal Circulation just last month.
Oh, my.
The healthy diet score based on levels of fruit and vegetable, fish, whole grains, nuts, etc. Recommended by the American Heart Association, with more than 80% rated as having a poor diet.
Don't you think it'd be beneficial to look at the public health school cafeteria?
Absolutely. Yeah,
man, carbs, fat.
That needs to go. That needs to change. See, 80% of the adolescent diet is unhealthy.
Yes. Treat yourself, right, Doc?
Yeah. This is more important. Yeah, other thing more important, the optimal physical activity levels also is not good. And the teenagers are kind of texting and watching TV. Overweight is kind of bad.
A lot of overweight business, porkies in that business. Got to get up off the couch, right?
Absolutely. Eat well.
Eat well.
Yes, eat more.
Yes, sir.
More of veggies, whole grain, fruit. Go nuts. On nuts. Eat less.
Eat less.
Less of fried food, starch, sugar. Say
no to soda pop.
Exercise more.
You bet.
5 times a week. Half hour or more till soaked
in sweat.
Well, exercise more. Walk, jog, run, bike. Treadmill, elliptical till soaked in sweat.
Well, so Dr. Ross, what you're saying is that diet and exercise They affect us through every walk of life. We can't
Absolutely.
eat like wild men when we're
Absolutely.
adolescents and expect things are going to change. That what we do as adolescents, what we do as young adults is going to have a far-ranging long-term effect.
You got it. You got it.
So we need to eat more veggies,
No veggies,
fruits, whole grains,
nuts.
and stay away from the other garbage that adds to the LDL. Am I following
That's
you
correct.
right?
Correct.
Low density lipoprotein.
You
What do you
got
think?
it. You got it.
I'm almost ready for medical school, huh?
You got it. You got it.
Well, Dr. Ross, we want to thank you for being with us. We appreciate the wisdom and the advice and the humility.
It's a pleasure. Thank you.
We just want to know that you're open to an invitation to come back and visit with us.
I will.
All right, we can check with your agent. We'd also like to thank the City of Champaign's UPTV production coordinator, Jason Liggett, the one, the only, and our intern, Caleb Serpenis, as well as our intern, 3-camera intern, Jacob Bernard, and the UPTV station manager, Jake Schumacher. We would also like to thank the Chorister Fellowship, Tiravala, Kerala, India, for the music score and that wonderful hallelujah ending. And we would like to thank you, every one of you out there, for watching us. We'd invite you to keep coming back because we have more information, and we call it breaking news, and it is definitely breaking news in wellness and health. So thanks for being with us. Have a great day. God bless you. We will see you next time.